Bismillahirrahmanirrahim. Good morning, everyone.
Good morning.
Welcome to the national webinar entitled The Third Nurse Proceeding International Conference of Advancement in Nursing Care, with the title Complementary Therapies in Community, Gerontological and Family Nursing. The webinar will begin in a few moments. Kindly ensure that your microphone remains mute throughout the event. Participants joining via Zoom are kindly requested to rename their Zoom account using their full name and institution. Thank you for your cooperation. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Distinguished speaker, honorable university leaders, respected guests, college and dear participants joining us both on-site and online, welcome. It is our great pleasure to welcome you to the national webinar entitled The Third Nurse Complementary Therapies in Community, Gerontological and Family Nursing, organized by the Professional Nursing Study Program, Faculty of Health Science, Universitas Muhammadiyah Magelang, in collaboration with Suraya Hospital Training Institution. First and foremost, let us praise Allah Subhanahu wa Ta'ala for His endless mercy and blessings, which allow us to gather today in good health and high spirit to participate in this meaningful scientific forum. Allow me to introduce myself. My name is Shifa Husna, and it is my pleasure to serve as your master of ceremony for today's event. On behalf of the organizing committee, I sincerely thank each of you for being with us today. We hope this webinar provides valuable knowledge, meaningful discussion, and opportunities to strengthen international collaboration in nursing. Before we begin today's event, please allow me to briefly introduce the agenda of this morning's webinar. Today's event will commence with the recitation of the Holy Quran, followed by the national anthems of Indonesia, Malaysia, Thailand, and Philippines, as well as the Muhammadiyah anthem, Sang Surya. We will then continue with the report from the chairperson of the Student Organizing Committee, followed by the welcoming remarks from the Dean of the Faculty of Health Science, Universitas Muhammadiyah Magelang, and the Vice Rector 1 of Universitas Muhammadiyah Magelang. After the official opening ceremony, we will proceed to the main scientific session, featuring 4 distinguished speakers from the Philippines, Malaysia, Thailand, and Indonesia. Each speaker will present their expertise on complementary therapies in nursing practice, followed by interactive question and answer session. At the end of the seminar, we will hold the certificate.
Excuse me, the MC, you are mute now.
Thank you so much, Purba. After the official opening ceremony, we will proceed to the main scientific session, featuring 4 distinguished speakers from Philippines, Malaysia, Thailand, and Indonesia. Each speaker will present their expertise in complementary therapies in nursing practice, followed by the interactive question and answer session. At the end of the seminar, we will hold the certificate presentation ceremony for our distinguished speaker, followed by a group photo session before officially concluding today's webinar. We sincerely hope that this webinar will provide valuable insight, encourage meaningful discussion, and strengthen international collaboration in nursing education and practice. To begin today's program with a blessing from Allah Subhanahu wa Ta'ala, we will start with the recitation of the Holy Quran. We respectfully invite our Qari to recite this version, the version of Holy Quran. The time is yours.
Assalamualaikum warahmatullahi wabarakatuh. A'udzu billahi minasy syaithanir rajim. Bismillahirrahmanirrahim. Ya ayyuhalladzina amanu taqullaha haqqa tuqatih wa la tamutunna illa wa antum muslimun. Wa'tasimu bihablillahi jami'an wa la tafarraqu. Wadhkuru ni'matallahi alaikum idh kuntum a'da'an fa'alafa baina qulubikum fa'alafa baina qulubikum fa'asbahtum bi ni'matihi ikhwana wa kuntum ala safa khufratim minan nari fa anqadhakum minha kadzalika yubayyinullahu lakum ayatihi la'allakum tahtadun. Wal takum minkum ummatun yad'una ilal khair wa ya'muruna bil ma'rufi wa yanhauna 'anil munkar wa ulaika humul muflihun. Sadaqallahul azim.
Thank you to our Qari for the beautiful recitation. May the blessings of the Holy Quran guide us in every step of our pursuit of knowledge. At this moment, we kindly invite everyone to rise for the national anthem. We will listen to Negaraku, Penchatai, Lupang Hinirang, Indonesia Raya, and followed by the Muhammadiyah anthem, Sang Surya.
งชาติและเพลงชาติไทยเป็นสัญลักษณ์ของความเป็นไทยเราจงร่วมใจยืนตรงเคารพธงชาติด้วยความภาคภูมิใจในเอกราชและความเสียสละของบรรพบุรุษไทย
Thank you for your attention. We shall now continue to the report from the chairperson of the Student Organizing Committee. It is our pleasure to invite the chairperson of today's national webinar organizing committee to deliver the committee report. The time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Bismillahirrahmanirrahim. The Honorable Prof. Insinyur Yun Arifatul Fatimah MT PhD Vice Rector 1 of Muhammadiyah University of Magelang, Nurse Kartika Wijayanti, the Dean of the Faculty of Health Science, Universitas Muhammadiyah Magelang, together with the faculty leadership, Nurse Priyo M. Kep, Head of the Professional Nursing Study Program, Todi Kamal S. Kep, MSc, Head of the Undergraduate Nursing Study Program. Our distinguished keynote speakers, Dr. Maria Luisa Uwayan, DHSG MS NPSN from Philippines, Asok Prof. TS Dr. Wan Isma Hanisa Ismail from Malaysia, Dr. Butsakun S. Guyot PhD RN FNP from Thailand, Dr. Nurse Sigit Priyanto MKep from Indonesia, Honorable Representative of Hospital, Healthcare Institution, Professional Organization, Faculty Member, Researcher, Student, distinguished guests, and all the participants joining us today. Ladies and gentlemen, first of all, let us express our deepest gratitude to Allah Subhanahu wa Ta'ala for His endless blessing and mercy, which have enabled us to gather today in good health for the third international webinar and oral presentation of the advancement in nursing care. On behalf of the organizing committee, it is my great pleasure to extend a warm welcome to all distinguished speakers, honored guests, and participants. We are truly honored by your presence and grateful for your participation in this international academic forum. This year, conference carries the theme Complementary Therapies in Community, Gerontological, and Family Nursing. As healthcare continue to evolve, complementary therapies have become an essential component of holistic and evidence-based nursing practice. Through this conference, we aim to provide a platform for sharing research findings, exchanging professional experience, and strengthening international collaboration in nursing education, research, and clinical practice. We are honored to welcome distinguished keynote speakers from Philippines, Malaysia, Thailand, and Indonesia, whose expertise and experience will undoubtedly enrich our discussion and inspire future innovation in nursing care. Today, this conference brings together approximately 220 participants, including nursing lecturers, researchers, healthcare professionals, students, and representatives from hospitals, universities, community health centers, and professional organizations. The conference is conducted in a hybrid format consisting of an online international webinar followed by an offline oral presentation session at the Faculty of Health Science, Universitas Muhammadiyah Magelang. On behalf of the organizing committee, I would like to express our sincere appreciation to the leadership of Muhammadiyah University of Magelang, the Faculty of Health Science, our distinguished keynote speaker, collaborating institution, sponsor, committee member, volunteer, and all participants for your invaluable support and contribution to the success of this conference. We sincerely hope that today's conference will strengthen academic collaboration, encourage the exchange of innovative ideas, and contribute to advancing nursing science and practice for the benefit of community both nationally and globally. Should there be any shortcoming in the organization of this event, we humbly ask for your understanding and sincere forgiveness. This concludes my report as chairperson of the organizing committee. Thank you very much for your kind attention. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much for the informative report and for the dedication of the organizing committee in preparing today's event. Moving on to our next agenda, it is our pleasure to invite the Dean of the Faculty of Health Science, Universitas Muhammadiyah Magelang, Ma'am Nurse Kartika Wijayanti, MKep, to deliver her welcoming remarks. The time is yours.
Okay, thank you, Mbak Siva. Excuse me, can you hear my voice, everybody? Can you hear my voice? Excuse
Yes.
me.
Yes.
Yes? Yes, okay, thank you. I'm sorry, my English dialect might be not very good with Ngablak dialect. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillahilladzi arsala rasulahu bil huda wa dinil haq liyudhhirahu 'ala dini kullih wa kafa billahi syahida. Asyhadu an la ilaha illallah wa asyhadu anna Muhammadan abduhu wa rasuluh la nabiyya ba'dah. Praise be to Allah, the most glorious and the most merciful. Salawat and salam be to our Prophet Muhammad Sallallahu Alaihi Wasallam, who has brought us from the darkness to the lightness. And I don't forget to thank to the Charkel, who has given me time to speak in front of you all. Good morning, and may peace and blessing be upon all of us. Our honorable guest, one, Prof. Yuna Arimatul Fatimah, PhD, Vice Rector 1 of Universitas Muhammadiyah Magelang, representing our esteemed Rector. 2, Head of Studi Program within the Faculty of Health Science. 3, Regional Leadership Council of the Indonesian National Nurses Association, Magelang Regency and Magelang City. 4, lecturers of nursing and pharmacy at Faculty of Health Science, UNIMMA. 5, our dedicated clinical preceptor from hospital and community health center across Magelang. And I don't forget to thank to our distinguished speaker, 1, Dr. Wan Isma Hanisa from University Teknologi Mara, Malaysia. 2, Dr. Botsakon S. Guyot, PhD, RNFNP, from King Mongkut Institute of Technology, Lat Krabang, Thailand, and her friend, maybe now. 3, Maria Luisa Wayan, DHSG, MSN, BSN from Our Lady Fatima University, Philippines. And 4, Dr. Nasikit Priyanto, MCAP, from Universitas Muhammadiyah Magelang. And my warmest greeting to all participants, steering committee and organizing committee, and our professional nursing student and undergraduate nursing student who are here today with great enthusiasm to learning. It is a profound honor for me as the Dean of Faculty of Health Science to welcome you all to the third International Conference, the Advancement in Nursing Care Proceeding, which this year take the form of an international seminar on complementary therapies in community, gerontological, and family nursing. We are truly delighted that this event can be held on Wednesday, July 29, 2026, bringing together expert, practitioner, and future nurses from across border and discipline. The seminar was conceived with clear purpose to broaden our understanding of how complementary therapies can be safely, ethically, and effectively integrated into nursing practice with community setting in the care of older adults and in strengthening family health. As healthcare continues to evolve, nurses must not only master conventional clinical skills, but also become knowledgeable about holistic approach that honor the physical, emotional, and cultural dimension of healing. Today's seminar is a step toward that vision, equipping our students and faculty with evidence-based perspective that can be brought directly to the bedside, to the home, and to the community. On this special occasion, I wish to express my deepest gratitude to all those who have worked tirelessly to make this event a reality. My sincere thanks go to Nurse Priyo, MCAP, Head of the Nursing Profession Study Program for this steady leadership and support for academic initiatives that elevate the quality of our graduates. I would so I would also like to offer my heartfelt appreciation to the steering committee chaired by Ms. Adi Subrata, Magister Keperawatan PhD, whose vision and guidance have shaped the scientific direction of this conference, and to the organizing committee led by Ria Andini Saputi, together with the entire dedicated team of lecturers and students. Your commitment, creativity, and hard work are the reason we can gather here today so meaningfully. To our distinguished speaker, thank you for generously sharing your expertise and for traveling from near and far to enrich our dialogue. Your contribution are the head of this seminar, and we are deeply honored by your presence. To Prof. Yun Afrifatul Fatimah, thank you for your representing the rector and for the universities and offering support for international academic collaboration. To all faculty members, clinical preceptor, and partners, your sustained mentorship is what makes event like this not just an occasion, but lasting learning experience for our students. To all participants, I encourage you to engage actively as thoughtful question and take full advantage of this rare opportunity to learn from a regional and international perspective. May the knowledge and inspiration you gain today strengthen your compassion, your competence, and your commitment to holistic nursing care. I wish you a fruitful and inspiring seminar. Welcome once again to the third at Nursing at Nurse International Conference. Wassalamualaikum warahmatullahi wabarakatuh. Thank you, Mbak Husna.
Thank you so much,
The
Ma'am
time is
Kartika, for
yours.
your inspiring word and warm welcome. It is now our great honor to invite the Vice Rector 1 of Universitas Muhammadiyah Magelang, Professor Insinyur Yun Arifatul Fatimah, MD PhD, to deliver her welcoming remarks. The time is yours.
Amin wa bihi nasta'inu ala umuri dunya wa din. Assalatu wassalamu ala asrofil anbiya wal mursalin. Asyhadu an la ilaha illallah wahdahu la syarikalah wa asyhadu anna Muhammadan abduhu wa rasuluh. Distinguished speaker, respected Dean of Faculty of Higher Health Science, Ibu Kartika Wijayanti, Vice Dean, Head of Department, the Organizing Committee, and also honorable guests, esteemed colleagues, and also all delegates from around the world. Good morning, selamat pagi, magandang umaga, sawade ton ciao, and a very warm welcome to everyone who is joining us virtually across time zones. On behalf of our rector, who sent her warmest regard and best wishes, it is my absolute honor and privilege as Vice Rector for Academic Affairs and Digitalization to officially welcome you all to the International Seminar on Complementary Therapies in Community, Gerontological and Family Nursing. We are particularly honored today to host an exceptional lineup of keynote and plenary speakers who bring a wealth of expertise and also international perspective to this event. Allow me to express our deepest gratitude to our great speaker. One is to ETM Malaysia, Thank you very much for being with us today, and thank you very much for the collaboration, very great collaboration. And then the second one, our great speaker also, Dr. Butsakon Guyot, PhD from King Mangkut Institute of Technology, Lat Krabang, Thailand. Thank you very much also for being us today. And also Miss Maria Luisa Ulayan from Our Lady of Fatima University, Philippines. And our beloved brothers, and also Vice Chancellor for the student,
Morning.
Dr. Sigit Priyanto from Universitas Muhammadiyah Magelang, Indonesia. Thank you all for sharing your profound knowledge, vision, and dedication with us today. And then if we look at our virtual screen, we are bringing together the brightness mind, the most compassionate caregiver, and the most dedicated researcher in nursing science. Healthcare is evolving rapidly, and our approach must become more holistic, innovative, and also deeply human. And complementary therapies are no longer just an alternative, they are an essential bridge in nursing practice, uniting traditional wisdom, our Indonesia, Thailand, Philippine wisdom, with cutting-edge science to heal the mind, body, family, and community as a whole. And to our student and young researcher, be bold, ask questions, and also push the boundary of what you know. To our practitioner and also scholarship, inspire, mentor, and share your invaluable insight. Let this seminar be spark that trigger new cross-border collaboration, I hope so, and also drive groundbreaking research and ultimately transform the quality of care, family, and community worldwide. I hope this seminar also will improve our collaboration nationally and also internationally. And with the great pride and enthusiasm, I officially declare the International Seminar on Complementary Therapies in Community, Gerontological, and Family Nursing open. Thank you again to all speakers and also to the Dean of Health Science, also to the Head of Committee. We're really proud of you, and I wish you all a high productive and inspiring seminar. Thank you very much, and I hope this seminar will be fruitful and also give a lot of insight to all of us. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you so much, Prof. Yun, for your inspiring message and continued support for nursing education and international academic collaboration. With the welcoming remarks now conclude, we are delighted to announce that the national webinar entitled The Third Earth Nurse, Complementary Therapies and Community, Gerontological and Family Nursing is officially open. Webinar bring you perspective, meaningful collaboration, and valuable scientific contribution for nursing practice. Please join me in giving a warm round of applause. We are now entering the highlight of today's program, the scientific seminar session. This morning, we are privileged to hear experts from the Philippines, Malaysia, Thailand, and Indonesia, who will share their knowledge and experiences regarding complementary therapies in nursing practice. To ensure that today's session will process smoothly, we are honored to invite our moderator to lead the scientific discussion. The moderator will introduce each speaker, facilitate the presentation, and guide the question and answer session. Without further ado, please welcome our moderator. The time is yours.
Okay, thank you very much, Siva, for opening the webinar session today. Assalamualaikum warahmatullahi wabarakatuh. Good morning to all distinguished speakers, respected lecturers, honored guests, and all the participants of this international webinar and oral presentation. It is a great pleasure and honor for me to welcome you all to today's seminar session with the theme Complementary Therapies in Community Gerontological and Family Nursing. Before we begin, allow me to introduce myself. My name is Nurul Purborini, and today I will be a moderator for the section 1 for this webinar. So, we are truly honored to have distinguished speakers from Indonesia, Malaysia, Thailand, and the Philippines who will share their valuable knowledge, experience, and perspective regarding to the implementation of the complementary therapies in the respective countries. So for this webinar, we will divide it into 2 sections. So for the first section, there will be 2 speakers followed by the first question and answer session, and then after that we will continue with the presentation from the other 2 speakers and followed by the second question and answer session. So without further ado, let's begin for the seminar session, and we will start for the session 1. So for the session 1, we will have 2 speakers here, and I will introduce for the speaker 1. So ladies and gentlemen, our first speaker this morning is Dr. Maria Luisa Wayan, DHSC MSN from the Philippines, Our Lady Fatima University. So it is a pleasure to welcome you, Doctor, to our webinar today. And then Dr. Maria Luisa Wayan will present the topic about the complementary therapies in community nursing practice in the Philippines. And before giving her the floor, allow me to read a brief profile of our first speakers. So Dr. Maria Luisa Wayan is a nursing academic from the Philippines who currently serves as a Dean of the College of Nursing at Our Lady of Fatima University and as a professor at the URMMC College of Nursing, and her academic and research interests including women's health, geriatric nursing, nursing education, and also community health nursing. It is a pleasure and an honor for us to have you, Doctor, for this webinar today, and we are grateful for the opportunity to learn from your expertise. And before we begin, I would like to inform you that we will have 35 minutes for the presentations. And ladies and gentlemen, please warmly welcome Dr. Maria Luisa Wayan. The floor is yours, Doctor. Thank you.
Thank you very much, Nurul. Can you hear me?
Sure, I can hear you clearly.
Okay.
Yes.
So I'd like to share my slide so that everybody can go with me in the discussion of very, very short. I think it would be less than 35 minutes.
Okay, it's okay. No
Mm.
matter. We will
Okay.
have a question and answer for the next
Yeah.
section.
Can you see my slide now?
Sure, we can see it.
Okay. Thank you very much for UNIMMA for inviting Our Lady of Fatima. And we would like to start our discussion with the title given to me was an overview of the role and application. So there will be 2 issues that I'd like to raise. Our role in the application of complementary therapies in the Philippines. Since my background is more on community health, maternal and child and geriatrics in application in public health. So I'll be focusing more on that. No? So just a statement of conflict of interest. There are no conflict of interest with regard to this presentation. And my presentation is based really on our international collaboration with UNIMMA. And then for our learning outcomes, so I expect, no, I don't know what will happen because, learners, you have different backgrounds. So I expect that at the end of the discussion, we'll be able to compare and contrast and learn from each other the different complementary therapy in our country and yours. We'll discuss the role and the application of this complementary care in nursing and utilize appropriate relevant complementary therapy in your community nursing practice. And of course, value our similarities and our differences, because that's how beautiful nursing is. When we put together our similarities and differences, we create a different tapestry of healthcare. So the role and application of nursing will be on this area. Okay. So wait, my screen is okay. So let's start. There are 4 issues that we'd like to consider as role in community health: holistic care, accessibility, integration, and empowerment. Why holistic care? Holistic care, when we apply complementary health nursing in holistic care, we don't just look at the physical. No? We don't look at the physical. We look at the emotional, and we look at the psychological aspect of the individual, so that when we use complementary care, it is there that we put the whole person at the center, our client at the center, and from that issue and from that perspective and dimension, we'll be able to deliver care. Accessibility. Generally, the Philippines is still a poor country, although there are a lot of cities that are urbanized, but yet people will be basing their healthcare on out-of-pocket expenses. So in order to answer out-of-pocket expenses, they would rely on medicines from herbal plants, and also what is the usual practice by the community. So whatever is accessible or whatever they can utilize at the moment, that will be considered. So we use that in community health nursing. And since Philippines is really a tropical country, we have a lot of herbal medicines growing around our provinces and our household. Then empowerment. When we utilize complementary health, we give the patient the power to take care or to take hold of his healing processes. So that's why we give them back the power with regards to their health, because we believe that health is a human right. Therefore, you also have an accountability to take care of your own health. So this is our framework when we utilize complementary care in the Our Lady of Fatima. So when we look into holistic care, there is the body, the mind, and the spirit of health being utilized. We integrate traditional and modern practices, whichever is applicable and whichever is found out to be effective for the people. And then there's accountability, accessibility, which means that whichever is affordable, no? One that they can really pay for, or they can afford, or just get from their backyard. And then it's empowerment, because the culture, the needs, and the usual power to take care of one's health is also highlighted. But one thing we would like to underscore when we do complementary care in the community is our ethical practices. Take note that not all herbal medicines have their own level of effectiveness. So we have to make sure that there is that level of beneficence, or do what is good, no? You prevent what is harmful. Also, as nurses, we have to have the responsibility to inform the people in the community of what is helpful and what is not. Not because it is available you will use, because sometimes the metal degrees that our herbal medicine has is still understudied. So we need to be responsible on informing that, our community. Accountability. So if there is something good that happened, if there is something bad that happened, there is a level of accountability from the patient and from the nurse herself. So we are accountable to give full disclosure to our clients on the importance or the usefulness of certain complementary therapy. So now for the application, there are 3 general areas that I'd like to share: our herbal medicine, other forms of therapy, and of course, the geriatric assessment trail, since I have a subspecialty on geriatric nursing when I finished from the University of Tokyo a few years back. I was able to design it is a form of model on geriatric assessment, and it's cooperated in the Philippines. So for the Department of Health in the Philippines, there are only 10. Okay? So very few. Of all the general herbal medicines, there are only 10 that are acceptable based on action, effectivity, the reaction, the normal side effects, and of course, we have to consider the nursing action behind all those things. So our local name for the first one is Sambong, which is Blumea balsamifera, probably because of the, we have a general topography from Philippines, Indonesia, Malaysia, and Thailand. It will also be available. So please take note of the scientific name. Blumea balsamifera is for kidney stones. No? So we use that if there are beginning formation in the kidneys. And this is used as tea. It's put in the morning tea, afternoon tea. And then we have Acapulco, the local name, which is Cassia alata, which is used for antifungal. In the Philippines, there are a lot of, because of the humidity, so there are a lot of fungus. So they take note of that for antifungal event. And it's very effective. No? And we have Nyug-Nyugan or Quisqualis indica, which is used for antipyretics. Most of our, in the rural area, they still walk barefooted. So they get the parasites through their feet, and they have a lot of parasites. So this is very effective to control the parasites. Then we have Chaanggubat or Etheria microphylla, which is anti-diarrheal, because people, they just put everything into their mouth and then they don't know it has something that will cause stomach problem. So we use that Chaanggubat. It's tea also. It's used for hot water and then you drink until the diarrhea disappears. And we have Ampalaya or Morpordica carantia, also good for diabetes. So it's helpful in lowering your blood sugar. Lagundi is very common, the Vitex negundo, which is for cough and for asthma. Ulasimang bato is Peperomia pellucida is anti-inflammatory, especially for gout, the aging population. And the last three, we have bawang or Allium sativum. We use that when we cook. In the Philippines, we use that. It has a nice smell. But it's also good for anti-hypertension. So sometimes it is considered as a chip. We just roast it in the pan and then put it in a small bottle and then put it in our rice when we eat. So it's a good anti-hypertensive alternative. Then we have bayabas, which is Pisidium guajava, which is antiseptic. We use it when in the rural area, when children had their circumcision, the boy, so we ask them to chew the leaves, and then after chewing, the juice is then spit into their newly circumcised organ. So it's a good for antiseptic. Also, it is good to use the leaves as tea, and then it is also good for the colon, for cleansing the colon. And then we have Herba Buena, which is an analgesic. So it relieves headache and some muscle pain. Now we go up, there are other traditional therapy. We have the hilot, it's called hilot, but it's called a massage, to promote circulation and prevent musculoskeletal pain. We have Bintusa, which we got from the Chinese. We have a long history with Chinese. So we use the Bintusa or cupping therapy for muscle tension and improve blood flow. The acupuncture and acupressure is also coming from our Chinese descent. We have a lot of Chinese influence. We have aromatherapy, the coconut oil and essential oil, which promotes relaxation and reduces anxiety. Of course, our faith and spirituality, sometimes we go to the oldest person in the community, So they would give us advice in terms of faith, in terms of spirituality, and prayers and anointing, and they have some recitations that would help them emotionally and spiritually. Because sometimes we have to accept it also that most of our physical pain came from our emotional and spiritual experiences or hurts that we feel emotionally and spiritually. Then we have the nutritional teas. We have the ginger, and then turmeric, and the malunggay. Malunggay is moringa. All of our countries, I think you also have moringa in your country. And it's very famous now. They have different offerings. They have in juice, in tea, or some other form. And of course, reflexology, which we also got from the Chinese, and it's being used, especially the oldest person in the community usually transfer his or her knowledge through the next generation to the son, the daughter, or the grandchildren. No? But not all of these are accepted by the Department of Health, so they still need to be evaluated by the Department of Health. Now, let's go to the geriatric assessment trail. This is the model that we utilize in the College of Nursing in the Our Lady of Fatima. So the geriatric is divided into the following. So G stands for gait and grooming. E is for emotional, economic, and exercise. R is rest and sleep. I is impaired mental function. A, activities of daily living. And we also promote that to the functional activities of daily living. Therapeutic activities and treatments, usually your medications. Recreation, independence. C is for connection, control, and communication. And S is for sexuality and spirituality. Why is this particular assessment trail utilized? Because it can be used in the community very well. It is a good guide so that the nurse will not forget any important parts in assessing the geriatric patient, especially in the community. So how does it happen? So you have all the areas that needs to be evaluated or assessed when you are in the hospital or when you are in the community. So you start with gait. Any difference in gait in normal should be a warning sign for you to look into what is the problem within the muscle, the bones. Is it aging or is it caused by trauma? So gait is number one. And sometimes gait is also important so that they can easily answer for emergency. You need to walk, you need to jump, or you need to be running. So gait is the number one point for assessing geriatrics. And then grooming. Sometimes when you grow older, you don't take care of yourself anymore. That's why you're smelly. You smell different, no? So you have to take note that the grooming of the aging individual, especially in the community, is taken care of. Then we have the emotion. Usually we say that when they grow older, their emotion changes, but it is really dependent on a different, the changes and the chemical changes in the body and the neurons and the action and dendrites that is transmitting in the brain. Also economic, because they're retired already, they don't have much money to spend. So it's very important that you assess their economic status. Exercise is important because once they stop moving, no, movement is very essential. So when the elderly becomes too tired to move, it's a warning sign. No? So you have to encourage them from exercising. Rest and sleep is important. But the rest and sleep time usually shortens because of, again, the changes in the dendrite and action in the chemical changes in the brain and the electrical conduction in the brain. So you have impaired mental function because of the wear and tear and the aging process that is happening in the brain. So we need to be aware of what level of functioning. Usually we use the MMSE, the mini mental screening test. And then we have to make sure that they can perform their activities of daily living. The usual one, eating, bathing, dressing, transfer from bed to chair, toileting is where moving around or how we transport them. And then we have to very careful when the treatments and medications our elderly clients is getting. Sometimes they have all entire pharmacy inside their stomach, and sometimes all those drugs, no, contradict each other. So you have to be able to assess what they are taking. Now, recreation is important because that gives them more time to use their muscle or to move around. And they spend more happy times with their families and friends. And if they can do recreation, they can also be independent. The more independent they are, the more the longevity is also increased. No? Then we have the C, control, connection, control, and communication. Even if sometimes when they age, because most of their friends died already. so they lose connection. Sometimes the family members, the children, they get married and they move to one province to another or one country to another. There's a connection is lost. So they have to be connected in a way. Now we have digital communication, so it has to be enhanced. But digital cannot replace the actual face-to-face connection, communication, and the capacity to control. Now, sexuality, even if they are all there are still expression of sexuality. Take note that when we talk about sexuality, it's not just the intercourse itself. We talk about sexuality when we express ourselves. How do we express ourselves as male and female? Okay. Sometimes female, they like to put makeup, or male, they want to go jogging and move around. They still want to do something to prove that they still are powerful. So that is their sexuality. Now, for spirituality, okay, so I was very serious a while ago listening to the prayers that was offered at the beginning of the program. And I think that is very important that in everything that we do, we are connected with Allah. We are connected with a greater power beyond ourselves. Okay, so that is geriatrics, and these are my references. Thank you very much.
Okay, thank you, Dr. Wayan, for the wonderful presentation related to the complementary in community nursing in the Philippines, especially for the geriatric. During your presentation, I just learned that some of the herbal medicine that you use in the Philippines, it's similar in Indonesia, but it's have a different names, because I think because the topography between the Philippines and also Indonesia is similar, because we are in the Southeast Asia, and like we do have the ampalaya and bawang and the others medicines, the herbal medicine. I just searched during your presentation just to know what is the what is the herbal in Indonesia, and yeah, we do use them as well for the herbal medicines, but some of them we just use like because of the like the tradition, not based on the clinical science. So maybe in the future we can do some research to see the traditional medicines based on the clinical science. Thank you very much, Dr. Wayan, for the wonderful presentations. And then we will move to the next speakers. The second speakers is Associate Professor Dr. Wan Ismahanisa Ismail from Malaysia.
Yes.
Okay, Prof. Isma. It's nice to meet you today.
Yeah,
It's
I'm
our
really
pleasure.
happy to see you again.
Yeah, it's
Yeah.
our pleasure to welcome you, Professor, to our
Yes.
webinar today. And for today's webinar, Prof. Isma will present the topic, the utilization of complementary and alternative medicines among the pediatric and thalassemia patient in Malaysia. So before we proceed for the professor presentations, allow me to read the brief profile of Professor Isma. So Prof. Isma is an associate professor from Malaysia and currently serves as head of center at the Faculty of Health Sciences, University Teknologi Mara Cawang, Pulau Pinang. Her expertise includes medical laboratory technology, public health, maternal care, and thalassemia. And she has also held various international academic appointments in several countries. So it's our pleasure to have you today, professors. And similar with the first speakers, so the time for your presentation is about 35 minutes, Professor. So ladies and gentlemen, please welcome Professor Isma. Professor, the time is yours. Thank you.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Thank you, Dr. Nurul, and welcome
Waalaikumsalam.
again. Thank you very much for the appreciations, and thank you to see you guys. I'm very happy to back to the UNIMA. Again, I think the last one we're going to 2025 last year, right? Yes, I've been here. So thank you very much to deans and all the head departments, all the committee members, and all the participants who are joining to the conference events. So, I will share the slides, okay? Oh, what is the foremost? Okay. Hmm. Sekejap, betul nampak. Okay. Nampak tak slide saya? Can you see my slides?
Yes, Prof. We already see your slide.
Okay, thank you. So, today I will share about the utilizations of the complementary and alternative medicines among the thalassemia patients, pediatrics, and also the adults lah. Actually, this is what the kind of the issue have to be highlighted related to thalassemia patients who are depending of the medicines for whole their life. Okay, I will be with the thalassemia patient almost 17 years. Okay, as be an advisor of the Society of the Thalassemia in Malaysia as well. So also the volunteer of the Global Hereditary Disease in Canada. So it is a part of me who are give a lots of the things to thalassemia patients. So this is what is the focus is the silence of the supplements. Okay, the patient conventional medical is the bloodline expose the fatal communications gap in the pediatric thalassemia care. This is what we call the silence. Okay, the silence of the supplement who are between the physician, between the doctor, between patient as well, who have the gap, okay, because there are not disclosures what they are using of the complementary alternative medicines together with the conventional medicines. Okay, but foremost, you have to understanding what is thalassemia genetic blood disorder. Genetic blood disorders of the bloods, okay, because this is what you have to know, the understanding what is thalassemia is all about. So then why they are depend on the others than conventional medicines. Because the thalassemia is called a genetic disorder of the blood who are depending of the lifelong treatment and the depend of the blood transfusions from the cradle until to the grave. Okay, when we involve, they says that inherited of the risk of the family members. This is only involved in one patient, involved with one members in the families, but it can be involved 1, 2, 3. It's possible. Okay, based on my experience. Okay, many of the families, okay, have the 2 or 3 children with the thalassemics. Okay, even though they are aware of there will be risk in the second of the third child will be in the thalassemic. Tetapi what is still continuous, because they says that it's okay, doctor, kita nak cuba lagi. Maybe the two or the third one, okay, will be normal. Okay, this is what you says that you are put your risk. Okay, you are put your risk because this is happen continuously. Okay, so because it's what? Okay, 68,000 children are born with the various thalassemia syndromes. Okay, 68,000, and be possible is you are in the future of the generation who are produce the children who young have to thalassemics. Okay, and it has been estimated that 900,000 newborn will diagnosed with thalassemia disorder. 900,000 newborns. Okay, this is what we are considered 2014, but now it's produced more and more. Okay, this is what visible burdens of the thalassemia in Southern South Asia Okay, in Malaysia as well, okay, we have the Malaysians registered 7,000 registered patient, and new cases are produced yearly. Okay, it estimate 1 to every 20 Malaysian have the carrier of the gene of the thalassemics. Okay, and Malaysian or Borneo as well, they are the highest one of the thalassemia patients. Okay, in active patients now more than 10,000 plus. If these are will be continuously, you are will be in risk of the uh, genetic burdens, okay, burdens of the thalassemics, okay. We are not assume that the all the in the maps turns to red. This is quite big. I have to notice that. Okay, this is what the prevalent thalassemia in Indonesia. This is what we experience. Okay, when we are involving with the members of the with involving the patient of the thalassemic in Indonesia, and then the presence of is the numbers of the thalassemic patient in Indonesia increasing year by year, and 2,500 newborns have thalassemia every year in Indonesia. Okay, and every single of the persons they are increasing around the 5,000 persons in 2012 to 9,000 people in 2018. This is what increasing very fast, okay? Because the prevalence of thalassemia is considered have the beta thalassemia, HBE thalassemia, is what is have two noted then when you have the beta thalassemia major, okay, they are prone to could depend on the other medication. Okay, actually they will taking of the sides of the medication that are involving with the complementary and alternative medicines. Okay, this is what the standards of you have to be in your mind. Okay, in Indonesia the expense is around 300 to 14 million required annually for optimal treatment for thalassemia patients, and and rising exponentially is about the rupiah 225 billion and 400 billion in late of 2018. Okay, so in a way, or in Malaysia as well, okay, in one single of the patient treatment is involving more than 200,000. So this is what you have to be in your mind, okay. Patient who are risk or depending of the conventional medicines are prone to get the other alternative because they are very tired, okay, they are very tired to comply all those treatments. Okay, this is what in the conditions in Indonesia, there are a very high of the increasing of the thalassemia patients. Okay, because you are the future generations who are potential to have the baby with thalassemics. Okay, this is what the Indonesia spends. Okay, 2.78 trillion treatment in 2020. Wow, this is what the numbers of the biggest of the spendings of the treatment of the thalassemia patients. Okay, when this is what we are mentioned, okay, when we know things that all the requirement of the patients, okay, we are uh, experienced, okay, these patients are prone to have the complementary and alternative medicine in thalassemia care. 80.26 prevalent, okay, use of the biological based therapy, herbs and everything, okay. And the thing is 65.8%, okay, are rarely inform the doctor, okay, because they says that 77.6 patients say physicians are never asked. So they will not talk. Okay. They have the communication gap. Okay. When the communication gap, okay, there will be a risk of the fatal because the conventional together with the complementary and alternative medicine will be a risk of the fatal because the combining of the anticoagulant, for example, with the ginkgo biloba and or the garlic can be lead of the serious of this consequence. This is what you have to bear, okay? uh, too afraid is because we are to working together to prevent together. Okay, not I'm says that you are cannot be taking of the complementary alternative medicines. No, okay, because they have the advantage, but they are together to prevent the factor of the risk. Okay. So this is 80.26%. Okay. Malaysian thalassemia patient utilize at least one form of the CAM. So this is what, together with the conventional care that are often derive the search for the holistic health or dissatisfactions with the clinical treatment. Okay, for example, okay, who are not thalassemia patient, when you are taking the antibiotic, okay, medicines, okay, the doctor said, okay, the doctor, okay, you have to be finish all these 5 days antibiotic, okay, probably, okay, you will be missed one day, okay, because you are in the you says that you are already okay, no coughings anymore, okay, so that you are not taking the and finish the antibiotic. But can you imagine, okay, in the start from the 6 months, yes, okay, 6 months old, okay, the babies who are depending on the medicines, okay, for 20, for 30 years, 6 of 30 years, okay, they are very boring, okay, they are not be compliant, okay, they are have so many of the side effect of the effect on taking of the medicines, okay, so they are put their risk, okay, put their health, okay, to taking of the other sides. Okay, so 80.26%, okay, are taking of the complementary alternative medicine to cure of to reduce the symptom of the illness. Okay, so this is what the categorize of the silent of the supplements, okay, in the patient of the thalassemia. The most common are taking of the gold milk, honey, green tea, black tea, vitamin C, garlic tablet, ginkgo, ginsengs, okay. So they are involving with the mind body medicines, okay, prayer, yoga, hypnotherapy, and meditations, okay, MBBT, massage, herbal bath, aromatherapy, and whole medical system and energy. We involve with the traditional melotherapies, traditional Chinese medicine, homeopathy, Ayurveda, and all those things. They are trying as much as they can to reduce this illness, okay? Because the pains are there, okay, so but the worry is happen, okay, when they're taking without the physician knowledge, okay. So this is what the patient, why a patient choose camp, okay. The motivation are parents seek perceive the safety of the natural remedies in preventive immunity and holistic wellness. Okay, the CAM user report the statistically significant higher score in the quality of life when using SCAM. There are improve of the vitality, physical functioning, and also the general health. Okay, but they have the hidden of the danger. Okay, because the lack of the scientific evidence for efficacy in the children. Unregulated products leading to severe of the unsick and drug interactions that must then set behind the temporary symptom relief. Okay, you can imagine the patient of the thalassemia, okay, when they are, when somehow someone of uh, propose to them, okay, you have to taking of the high of the iron, okay, ambil zat besi lebih, okay, is good to your body, okay, to improve your HB level, okay. But to notice then, okay, the patients yang tinggi zat besi tak boleh makan coklatnya, okay, delimanya, buah delimanya, okay, and then what kind of the things, daging merah, bayam, okay, so kurma, all those things that will be put their body into the risk, okay, because in their patient thalassemia bodies, okay, there are very highest of the iron, okay, because they're taking of the blood transfusions. Okay, this is what 30% of the children might have used some the form of the camp, and often based on the parental belief and recommendation from the family and friends. Itulah. That's why we our recommendations from family and friends. This is what we uh, uh, their knows. Okay, family members knows only this. Okay, because the patient dia nampak anak dia, this one boy, okay, have the problem with the hemoglobin. Okay, so they are taking of the kurma, okay, sayur bayam, broccoli, and also those things yang can improve dia zat besi, the HB level. Okay, but towards the end, this big boy will be in risk because they says that this can improve the HB. Sebenarnya, in the real situation is menyebabkan anak dia boleh going to the fatal of the deaths. Okay, because of this of the do not know. Okay, the risk of the taking another of the medicines. Okay, so this is what the communications breakdown. Okay, the silence of the clinical treat, we have to be understandings. Okay, the patient as well. Okay, so this is must to do working together. Okay, the doctor must be understanding why the patient are taking the complementary and alternative medicines. Okay, so from the 313 patients, okay, it's a lot of the patients. Okay, for example, who are doing we did the research. Okay, 80.26% actively use a camp. Okay, this is what they are need to be considered. You have to break down the problem. Okay, because the silence of the usings of the complementary and alternative medicine will put the patient in risk. Okay, so this is what they are using. Okay, for example, the understanding. Okay, the green tea known to prevent the iron overload and decrease the serum ferritin level. Okay, so the massage, the prayer, aromatherapy, this is what is great to do. Okay, there's no problems. Okay, when they are using this camp. Okay, but uncontrolled vitamin C, okay, for example, and using of the warfarin combined with the ginkgo or garlic or the ginsengs, can be plunge the patients into the death. Okay, and also that says that the black tea are shown to lead to the worsening of the thalassemia conditions. Okay, this is what to have this what you have to consider in the risk is not or not. Okay, because and in one my experience that patients cannot reduce their serum ferritin. Okay, when we do the investigations. Okay, because the thing is they are using of the complementary medicines together with the conventional medicines, so then they are cannot be works. Okay, so this is what I'm already experienced that before. Okay, this is what they are in a risk. Okay, so we have to prevent of the pregnancy risk. Okay, because in each of the pregnancy, there are 25% getting child with the thalassemia on every of the pregnancy. Okay, this is what the CAM use among the thalassemia patients. Many things. Okay, they are trying as much as they can. Okay, to reduce of their illness. Okay, kita tak boleh nak says that you cannot be taking that, you cannot be do this, you cannot do this. Okay, sebab okay, sakitnya terlalu lama kan. Okay, in about the 20 to 25 years, it's all terlalu lama. Okay, dia akan cuba sedaya upaya untuk kurangkan kesakitan dalam badan dia. So, not to taking of the conventional medicines. Okay, they will spend a lot of money, okay, to buy of the complementary alternative medicines. Okay, actually, is less than not sure they are spent. How much they spend? Actually, more than 100 ringgit, more than 200 ringgit. I really insist that one patient of me, okay, the Chinese one, okay, they are taking of the complementary medicine. It's called the spirulina. is costing about 2,000 plus, okay, per week, okay, to prevent to get the blood transfusions monthly. Okay, if that is they are taking the spirulina and they are not the patients are not taking of the blood transfusions. Okay, they ambil spirulina, then they avoid to get the blood transfusions. Okay, for the first or 2 weeks, 3 weeks, okay, they will see that the HB level is very good. And then they spend a lot, the 2,000 plus per week. It's not per month, it's per week. Okay, so until 2 months, there will be avoid to use the blood transfusions, okay, but the sudden of the drop of the HB level. Okay, this is we don't know. Okay, what is considered then? Either they have either of the spirulina they are taking or other sides of the effects. Okay, so this is what the sources of the information of the camp you have to be understandings. Okay, many media master TikTok, Shopee, everything do the advertisings. Okay, they are very good advertising of the sells their products. Okay, this is what we have to be counter. Okay, to have to be understanding how to choose the real of the product that can be used good to your body. Okay, the rule of the silent why patient hide their can use because they says that there are 27% okay believe it was not important. 19% believe the doctor had a little knowledge. Okay, what for? What for we will talk to the doctor because they don't know about the complementary alternative medicines. They don't know about the spirulina. They don't know about any kinds of the medicines related to complementary. 18.6% active fear, okay, will be afraid of to talk with the doctor because they says that the doctor are not approved. Then when they are sharing about these medicines to the doctor, okay, and 14% they are never ask, I never tell, okay, because what for I need to tell the doctors, okay, because the doctor already supply with the medicines with me. Okay, fear that conventional therapy would be terminated by the physicians. Okay, they says that kalau dia bagi tahu, okay, the doctor will says that they will terminate all the medicines that are giving to them. Okay, this is what they are believe. Okay, why they are hide the use of the camp. Okay, this is what you have to break down of the communications, okay, between the doctor and physicians, between the physician and the patient as well. Okay, you have to be in your mind. Okay, the communication is one of the large of the problem is happen in the world. Okay, this is based on the experience. Okay, in other ways of the medication or all those things. Okay, this is good to the breakdown of the communications. Okay, this is what I am already mentioned over. For example, vitamin C. Okay, excess of the vitamin C uncontrolled to expose the patient to the cardiac risk. Okay, because in the way of the treatment, patient already given with vitamin C during the iron chelation therapy. Okay, the excess with of the level of the iron deposit in the hearts, and then moreover, the drink of the black tea increase the could leads to the thalassemia patient, and using the green tea can prevent iron overload and decrease the level of the serum purity. This is what they have the advantage. This is not we says that no advantage of the complementary anti-medicine. There are proven that have the some kind of the things that we see will be see that give the advantage to the patient, but when they are considered to the risk, okay, you have to be in your mind to be careful when you are taking to all others of the complementary. Okay, this is what, okay, we don't know. Okay, many patient of mine, of the thalassemia patient in Malaysia, they are the sudden deaths, okay. They are sudden deaths, okay. They are using of the intake of the 1,000 milligram per day, and then taking the other side of the vitamin C's, okay, because they are taking together with the other complementary. Okay, this is what they are will be increased and the deposit in their hearts. Okay, and then to be is cardiac risk. Okay, so this is what. Okay, biasanya banyak sangat case of the cardiac risk among the thalassemia patients. Okay. So this is what the warfarin, okay, the taking of the ginkgo biloba together with the garlic and then using of the warfarins, okay, they says it's good to have it, okay, but the consequence or serious consequence or death will be happen in the patient of the thalassemia, okay, who are taking all this together with their conventional medicine that provided by doctors. Okay, doktor tak tahu kan, they are giving the warfarin to the patients. Okay, but at the same time, patients use the ginkgo biloba and garlic or the ginseng as well, okay, to improve their natural health body, to booster them. Okay, but towards the end, they control uncontrolled hemorrhaging and the series of consequence of death. Okay. The disclosure breach of the protocol of integration, okay, proactive inquiry, okay, break the never ask, I never tell. This is what you have to break it down, okay? Multidisciplinary of the collaboration, pediatricians, camp practitioners, specialists, doctors, nurses have to collaborate the map or monitor the child of holistic progress and manage the interaction of the risk. And also educate parents specific interaction. Okay, parents must give fully of the inform of the consent and understanding the natural require of the clinical or monitoring when using together with the conventional medicine, part of the herbal treatment, okay, complementary. Okay, integration is not isolation. Our patients are already living in the both worlds. Okay, to protect them, our standards of care must do the same. Okay, we cannot break it down. So because they are living in the both worlds. Okay, the same things. Okay, wherever you are go. Okay, you are be involving with these matters. Okay, but we have to be integrate and not to isolate them. Okay. Thank you very much.
Thank you, Prof. Isma, for the insightful presentation related to the complementary medicines for the thalassemia patients in Malaysia. And from your presentation, that we know that there are some, how to say, I think it's not a problem, but maybe like some issue that we need to resolve related to the communication. I mean, because most of the patient, the thalassemia patient, they don't say or they don't report their using of the complementary therapy from your
Yes.
presentations. Yeah. So
Okay.
okay, thank you so much, Professor, for the
Okay.
presentation. And now we move to the question and answer session one for our two speakers, Dr. Wayan and also Prof. Isma. So all the participants, if you have a questions, you can read in the chat box or raise your hand so you can say your question directly. Okay. Okay. Anyone want to ask a question, whether for the Dr. Wayan or Prof. Isma? Please welcome. Okay, we have okay, let me check. We have a questions in the chat box. Let me. Okay, so here is a question for Dr. Wayan. It's from Anita from Karyadi Hospitals in Semarang. So, hello, Dr. Wayan. I'm Anita from Karyadi Hospital. I would like to ask if there are any classification for herbal medicines based on which one have immediate effect and late effect? Mhm.
Thank you very much for that question, Anita. Nice to meet you. I hope I can meet you face to face next time. With regards to the late effect and the immediate effect, there are no particular study, but we base them on the relief that was mentioned on the presentation, the effectivity based on the comments of the patient. But probably that's a good um, uh, research area, immediate and later effect but it would be more on the part of the pharmacist rather than the nurse with but we would consider. There is no existing study on that. Thank you.
Okay, thank you, Dr. Wayan. Ibu Anita, do you have any do you are already clear with the answer, or do you have further question related to your first questions? Okay, let me check. Okay, here also second questions. It's for Prof. Isma. It's from Bapak Eko from Sawangan. Assalamualaikum. I'm Eko Prasetya from Sawangan to Public Health or Puskesmas Indonesia. Question is to Prof. Isma. Is garlic can be coagulant? Can be coagulant? If it can be, is it contraindication for stroke patient?
Okay. Okay, thank you very much for the questions. What the names of the Eco, yeah. Pak Eco Prasitoyo. Okay. So of course, the garlic. Actually, the garlic is the one of the things yang will be one of the things. For example, who are taking of the warfarin actually. Okay, kalau kita ambil warfarin together dengan garlic, yes, there will be sure. Selalunya stroke patient ni dia memang akan ambil warfarin. So to bear in your mind to be considered and be careful when you are taking all these medicines. Sebab itulah kadang-kadang kita harus berjaga-jaga kalau mengambil ubat selain daripada ubat di hospital provided by the doctor, sebab they'll be put the risk because kerana ubat yang di hospital itu have the side effect when you're taking with the garlics. Okay, thank you.
Okay, thank you, Prof. Isma. Pak Eko, it's already clear for the answer, or do you have still any further questions? Okay, we still have. Okay, it's already clear, Prof. Thank you. Okay, so we still have 2 minutes left for the question and answer section for the section 1. So is there any question from our participants? Okay. Okay, there is no more questions, or we still we still have. Okay. Okay, so if there is no more questions, okay, let me check if there is. Okay, if there is no more questions, we will wait a minute.
Nurul, I think there's one about cancer.
Oh, really? Okay, let me check.
Yeah. Our patient who are undergoing chemotherapy
yeah.
after
Yes,
an
doctor.
episode
So
of
it's
CIN.
another
Which
question
complement
from
therapy best?
yeah.
Okay.
This from it's further it's the next question from Ibu Anita from Karyadi Hospital. So she also want to know. I would like to
Nurul, you
ask
put your microphone closer.
yeah. Okay. So our patient undergoing chemotherapy component the episode of GNMP with
You saw? You saw
Yeah.
you saw it already.
Yeah.
You put your microphone closer. I cannot hear you.
Oh,
The
sorry,
mic.
sorry,
Yeah,
sorry.
yeah, like that.
Okay, okay, okay. Sorry. So it's another question. So Ibu
Yeah,
Anita also
with
asked me
cancer.
other questions. Yeah, it's about
Mhm.
the complement therapy for cancer patients that
Yes, okay.
undergoing on the chemotherapy.
Pokoknya
Yeah.
Yes.
Mhm.
In the Philippines, either you go on full chemotherapy or you go to complementary. Our current study, there's no exact result yet, but there are positive comments. The use of herbal medicines, we call it in the, I forgot the scientific, guyabano and moringa. They powdered it and make it into a tea, and then they use this consistent for the day. The patient need to consume around 1 to 1.5 liters. So I put here in the chat box. It's guyabano leaves, and moringa.
Guyabano leaf.
Moringa is our malunggay. Yeah, it's
Yeah.
okay. So they use this used as tea, daily use. Okay, we have daily use. So we have some comments, but there's no scientific effect because when we do this type of study, we have to work with the pharmacist and the medical doctor in preventive medicine. So it's a joint effort. So the result yet is probably in the next conference, Nurul. We can do that.
Yes, sure, Dr. Wayan.
We invite you to come to Philippines.
Okay. So,
Thank you.
you're welcome. So, guyabano is the guyabano leaf is daun sirsat in Indonesia. Yeah.
Okay,
And
that's good. That's good. Yeah,
yeah,
thank you very much. Thank you.
you're welcome. Yes.
Mm.
Okay. Because we already because the time is up for the question and answer section. Thank you very much, Prof. Isma and also Dr. Wayan for the wonderful presentation and also the question and answer section. And here is the time for certificate handling. So, Butika, the Dean of Faculty of Health Sciences, already in Zoom. Okay, Butika, for giving the certificate. Okay, please wait, Butika.
Okay, thank you.
Okay, okay. Butika, you already in the Zoom. I think I hear your voice. Yeah, because we have the other agenda, Professor Isma and also Dr. Wayan. That's internal audit from our university. So, okay.
Thank you very much, Nurul. Until the
Yes.
next speaking engagement, next
Thank you.
seminar.
Thank you, doctor. Thank you. See you soon. Okay. Thank you very much,
Okay.
everyone.
Thank you. Okay. Thank you so much. Okay. we-
Oke, Mbak Purba.
Oh,
Now?
okay. Butika already in Zoom. So Butika, please, kindly give the certificate to Prof. Isma and also Dr. Wayan. Butika, thank you.
Oke, thank you, Miss Purba. Okay, as a small token of our gratitude and respect, I would like to present you with the certificate appreciation. May I now invite Maria Lucia Wayan, DHSG, MSN, PSN from Our Lady Fatima University, Philippines, to kindly come forward to receive the certificate. The certificate, Mr. Purple? Yes. Thank you, Dr. Maria Lucia.
Thank you very much. Thank you.
You're welcome.
Thank you.
Next, Putika.
Yes. Okay, Miss Nurulpo. And now, may I now invite Dr. Wan Ismahanisa from University Teknologi Mara, Malaysia, to kindly come forward to receive the certificate. Thank you,
Thank you very
Dr.
much, Doctor. Thank you very much.
You're welcome.
Okay, thank you, Prof. Isma, Dr. Wayan, and also Butika. Thank you so much for attending our section 1 for the webinar today. Thank you so much. Hopefully, we can meet again in the next year webinar. Thank you so much. Okay, see you. Have a nice day for all of you. Thank you so much. Okay, next we will move to the section 2. For the other two speakers and for the section 2, the moderator will be Lia Agustina. So for Lia Agustina, the time is yours, please.
Thank you very much, Mr. Nurul Purpo, for leading the first session. Good morning to all distinguished speakers, respected collectors, honored guests, and all participants of this international webinar. It is my great pleasure to welcome you to session 2. My name is Lia Agustina, and I will be your moderator for this session. Before we begin, may I kindly remind all participants to keep their microphone mute throughout the session to ensure the seminar runs smoothly. Ladies and gentlemen, we will now continue to the second part of our seminar. Our third speaker is Dr. Busakan Seharatanapatum, PhD, RN FNP from Thailand. It is a pleasure to welcome you to our webinar, Doctor.
Yes, thank you so much. Can you hear me?
Yes, Doctor.
Okay.
Dr.
So,
Busakan,
yeah.
PhD, RN FNP, will deliver a presentation entitled Complementary Therapies Using the Holistic Care and Grounding Technique in FNP in Thailand. Before inviting her to present, please allow me to briefly read her curriculum vitae. Dr. Busakan Seharatanapatum, PhD, RN FNP, is a lecturer and nursing practitioner from Thailand with expertise in maternal and child health nursing, family nursing, occupational health, and smoking cessation. She currently serves as an instructor at Kuakaran Faculty of Nursing, Navamidra Diraj University, and has previous clinical experience as an emergency room nurse in Thailand. We are honored, Doctor, to have such an outstanding speaker with us today. and we truly appreciate her presence and willingness to share her expertise in this international academic forum. I would also like to remind everyone that the allocated time for this presentation is 35 minutes. Ladies and gentlemen, please welcome Dr. Busagan Seharatarapatum, PhD, RN, FNP. The floor is yours. Please proceed, Doctor.
Okay. Good morning, everyone. And now I'm on vacation and I'm at the US. So the time right now is almost 9 p.m. So I'm happy to be here with all of you. And let's get start with the complementary therapies using holistic care and grounding technique in the family nurse practitioners in Thailand. And before I start, I would like to grateful for the Dean of University of UNIMMA and the staff and all of the keynote speakers and the MC. And the most important is all students who attend this conference together, right? So start with the Thai family nurse practitioners holistic health promotion in Thailand. We also integrating herbs and grounding for all age group because the family nurse practitioner have the the skill to take the primary care for the whole family. It's not only the children, the pregnant women, the adult or the elderly. It means the whole family as the contact of the community. That's why family nurse practitioner must have the skill for health assessment for a family and also know the way how to provide the health education, health promotion based on the complementary alternative therapy. We didn't suggest that the patients who have their own medicines prescribed from the physician to script. We suggest that they should have like a variety of food, and the most important is the supplement that's made from the earth or natural products, something like that, right? Because the healthy eating behavior that's very important for health and body. For the family nurse practitioner role, primary and holistic care that I taught in earlier, assessing health across the lifespan, providing preventive care and it's like if the patient or the family there is no sign of the non-communicable disease, we use the health promotion for promote health to maintain healthy behavior, right? But if somebody or some of family member have the list of genetic, such as like the professor told us about the thalassemia, that is the genetic disease, right? And I will mention later after this slide about the iron deficiency anemia. That is the another anemia that is the difference from thalassemia, and the food that they should have also different opposite, because the thalassemia have the it's like the red blood cell broke before their life, so it will have the patients have more iron. However, for the iron deficiency anemia, we'll have the problem for the pregnant women who have the insufficiency of iron before they pregnant. So this I will mention later. So for the family nurse practitioner role, we access the help and to take care of the patients, we can use the counseling technique and also integrating or and grounding technique that I will demonstrate after, right? And the traditional Thai herb medicine, we have the turmeric, ginger, and lemongrass. All of it, and the most important is, the lemon. My vitamin C is also a general herb in around the world. However, these herbs can be help and stimulate or boosting immunization for the family member in all age group, but it's different in the proportion, right? For the health promotion across the lifespan, we include the children, pregnant women, adults, and the elderly. And the grounding and mindfulness technique. This is also connecting the earthing to reduce stress, improve sleep, and enhance energy flow. The policy and healthcare integration national framework in Thailand, the Ministry of Tropic Health, is with the Department of Thai Traditional and Alternative Medicine to formalize traditional practice into primary care. Thailand Universal Coverage Scheme officially cover reorganize the herbal remedies, Thai massage, and postpartum therapies, enabling family nurse practitioners who seamlessly deliver integrated care. So, in my major that I graduate and I conduct my dissertation, I conduct in the area of the balanced diet and iron supplement in the pregnant women with iron deficiency, anemia, and smoke, secondhand smoke because the husband smoking a cigarette more than 20 tobacco per day. So that's why this happen, and it can make the pregnant women with anemia, with iron deficiency anemia, have severity of the anemia too. Foundations of the Thai healing, holistic health philosophy deeply rooted in the Buddhist principle and natural harmony, health represents wellness across body, mind, and spiritual dimension. Family nurse practitioner leverage this cultural framework to promote disease prevention, emotional balance, and holistic patient engagement. So I have some of the video to share with you about 1 or 2 minutes to 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 share about the healing touch.
I always leave feeling so much better than when I started. I found it really relaxing. I would have healing touch actually during my chemotherapy. It's a mentally tough journey to go through cancer treatment. It just helps to calm things.
Going through cancer treatment is an emotional experience. It's a physical experience. It's very tough. It's so refreshing to be able to go in and talk to a patient about, this is something that I want to do that focuses on your mind, that focuses on your body. We're not injecting you with something else. We're not making you go down for an x-ray. We're going to try to really help you feel better. And I think a lot of people respond to that.
Healing touch is a light touch technique that uses hand positions that are either on or just above the body. I'm a nurse. I'm an RN. I've been a nurse here at the hospital for over 25 years. I see healing touch as supportive. It's complementary to the treatments that patients are receiving. Healing touch can provide that time to be still and go to that quiet place within
what I've heard back from patients is they just feel that it helps with symptoms like nausea. And I think it has a calming effect. I've had some people tell me they slept better. It could help them get through these very difficult therapies better.
Sometimes things are running through your mind and what maybe you have to do and what's going on. And after my first session, there was no turning back.
Okay. So the core complementary modalities, Thai massage or acupressure, therapeutic Thai bodywork targeting sense energy, like to alleviate musculoskeletal pain, reduce stiffness, and restore physical mobility in community clinics. And also the herbal formulations, evidence-based herb prescription, endographics, turmeric, and hot compress used for inflammation, respiratory health, and chronic recovery. And my body practice, Buddhist mindfulness, meditation, guide breathing, and gentle physical movement designed to reduce stress, anxiety, and hypertension. This is the clinic that I and my husband who passions with the alternative Thai medicines. We open the clinics, our own clinics, Relax to Recovery Spa, and Daniel, he is the graduate from the University of Illinois, USA. That's why I come and take vacation and visit his family for 3 weeks, right? And for me, I'm a PhD in nursing and family nurse practitioner. And right now, we run the clinics to help the staff and the student to quit smoke. We call this project is Clean Lung Project. So for the earth and strategy to quit smoking for a pregnant white husband, preventing secondhand smoke for a healthy pregnancy, based on the strong evidence, so that there are several factors that can make the pregnant women with anemia can lead to the adverse pregnancy outcomes such as preterm birth and low birth weight infants. So that's why we focus on the topics of the second-hand smoke with the iron deficiencies anemia. That is my expertise in this area, right? Based on the healthy eating or health behavior before pregnancy is very strong related to their health status. If this pregnancy have the insufficiency of the iron before pregnancy, she will become the mild, moderate, or severe iron deficiency anemia the whole of her pregnancy. That can impact to the children or the baby in her uterus, because it can make the IUGR, intrauterine growth restriction, and then this baby can give birth. She can give birth preterm birth, and also have the problem with the low birth weight infants. So the complementary alternative medicine preventing preterm birth and low birth weight infants in case of the pregnant women with the anemia. The type of anemia is the iron deficiency anemia. And also for the holistic care that we take care, we didn't focus on only the physical dimension. We take a look at the body and mind and also environment, right? What can harmful for the maternal or the fetal health. We can provide health education and also let the family participate with the treatment or intervention. For the maternal stage reduction, reduce the cortisol. Reduce the cortisol, improve the mood, lower chronic state, and less inflammation, uterine irritability, because all of these can stimulate the contraction before, as we call the premature contraction, right? And second is the improve nutritional intake, the supplementation that the physician will provide for all pregnant women. However, for the thalassemia in Thailand, she will receive the folic acid, right? But for the iron deficiency anemia, she will receive the folate formulate at the gestational age, more than 20 weeks, because if before 20 weeks, she will have the problem with hyperemesis. That is the side effect of the what we call the iron supplement, right? So the most important is the nurse should mention that she should take the supplement regular, and the most important is the dietary optimization, that should have the variety food and cover a 5 food group also. This the optimal maternal physiology. We need the baby was born full term without any problem of the low birth weight infant, because longitudinal study mentioned that the baby was born with the preterm birth and the low birth weight infants less than 2,500 grams. This group of the baby can produce the non-communicable disease in the later life when they become the elderly. That is the longitudinal study. This for preterm birth, we give the definition is the age less than 37, and low birth weight infants we provide at the less than 2,500 grams. Yes, and this is the last one is the herb can also make the pregnant women relaxation, but the herb should come from like raspberry leaf, but it should script of the tea, caffeine, or something that can make the iron absorption difficult inhibitor, such as the tannin from the tea and the phytate from the soybean or something like that, that can forbidden the absorption of the iron, that can make the pregnant women have the problem with severity of anemia. And for the omega-3 or fatty acids fish oil, we provide the fish oil during the second trimester. However, in the third trimester, we recommend the script not to take the omega-3 because it will have problem with the breathing, cannot stop breathing during she give birth, no matter normal birth or C-section, right? Okay, so the research show that the healthy eating is related to the maternal health status and the fetal health, and the most important is secondhand smoke is also increased, can produce the severity of the anemia the whole of her pregnancy. So this time we can use the positive communication to convince the husband to know that the smoke in the area that the pregnant women stay there can harmful for her health status and also fetal growth also. So that's why we need the husband to aware and think about how he can make the good things is like a gift for the baby and the mother. So some husbands they have two ways, they're guilty that they they don't know exactly he smoked outside of the house. Why this happen or affect to his wife? That is because of the second-hand and third-hand smoke. The surface of the clothes and the hair and the body can touch of the nicotine, and it's like a 7,000 or 15,000 chemical in the e-cigarette or also normal tobacco also affects to the blood of the pregnancy and also happen to the growth development of the fetal too. So these ingredients of the we can suggest or recommend the husband who would like to skip smoking or quit smoke with the ginger and licorice, peppermint, and clove, cinnamon, and also the lemon with the cover of the lemon, and fruit high in vitamin C also can help the smoker can reduce the when they would like to smoke, they can postpone and do something else and take a deep breathing, right? So I'm gonna mention about the biologically based approach and manipulative and body-based therapy, energy therapies, my body intervention, and alternative medical system. The clip video that I opened in earlier is to mention about the energy imbalance. So they have the option of the healing touch that can make the feeling of the patient and the therapist can work together as the soft power of the healing touch that the AI cannot do this. Just only humans who can using the cloud technique for help people to balance the energy. So with the grounding exercise or the grounding technique to release the anxiety and stress. Can you see the picture? This also can describe clearly about the release the energy from the body. Every day we work, we open our mind, we open our eyes, and many things allow us can produce the stressful. It depends on the threshold of the people. However, during the day, if he or she have the body under stress, that can affect to sleeping cycle, eating cycle, immunization system, and many things, right? So the grounding technique will use the body as the friendly with the natural, not to take the shoes and use the foot step on the ground or the grass, and the hand can also touch the tree, something like that, to release the energy, negative energy in our body to transfer to in the ground, something like that, right? So with the 5 technique of the grounding exercise, first thing, what you can see, you use your eye, take a look at around uh, around you. what you see, you can see the tree, you can see many things around you, right? The second thing, you use your hand, you use your foot, you use your feet, touch the ground or touch the nature. And what you hear, you can hear the wind, you can hear the bird sound or something like that, and you can smell something. It's like after landing, you can smell of the rain or the flowers, something like that. And the last thing is you can taste the taste. However, when you stand on the ground or on the backyard, the taste can you can touch just normal water, take it like during your breathing, take a deep breathing that can make you have more relax and release the tension. This we call the biofeedback. This is my husband is the biofeedback coaching trainings also. So we apply all of the techniques of the biofeedback to take a look at the heart rate variability, to take a look at the breathing cycle and the pulsation and the temperature to measure that the body more relaxed and the breathing cycle normal, something like that. This biofeedback can treat the chronic pain and the cognitive impairment, psychological disorder, medical conditions. And the most important is how it works. It works based on the cell regulation and pain management, sleep improvement, and stress reduction. The most important is to self-care of yourself. Thai massage in the primary nursing is used for pain management, and I also can use during I attend the pregnant women before give birth the first day of labor to release the labor pain, and for the stroke behavior stroke rehabilitation and postpartum wellness for the family nurse practitioner can also apply all of these for their daily routine or daily life. It's like a expertise in the area of complementary alternative therapy. You can use the healing touch or you can use the biofeedback for trainings about the breathing style, impact on the chronic disease care. In our clinic, we apply the biofeedback for non-communicable disease. The women with the age 65 years old, she is diagnosed as the diabetes mellitus type 2. So during the day before she went to the hospital, she is some kind of have the problem with insomnia, and also she cannot sleep well. She feel she had anxiety and stressed, so this can increase her blood sugar. And the most important is the family member who smoke also affects to her her life, and also it affects to the blood sugar and the blood pressure too. So non-communicable disease.
Excuse me, doctor. Yes. I'm sorry,
My
this is
wife.
a general reminder that you have 3 minutes remaining for your
Okay.
presentation. Thank
Okay,
you.
thank you so much. Okay, so this is the my evidence support about the Thai traditional medicine-based detection care program for older adults that they use the Thai traditional medicine base care program protocol, weekly 60-minute session for older adults. And another paper is the here is the so finally I can tell that the ancient time Thailand also used the herb and alternative medicine until the AI coming. However, for the healing touch, the AI cannot make it as a human. Yes. Thank you so much for your attention. Okay.
Thank you very much, Dr. Buseken Seharatana Patum, PhD, RNFNP, for such an excellent, informative, and inspiring presentation. We can conclude that complementary therapies play vital role in family nurse practice, or FNP, in Thailand by integrating traditional healing with modern healthcare, guided by a holistic psychology that addresses physical, mental, and spiritual well-being. FNPs utilize evidence-based approaches such as Thai massage, acupressure, herbal medicine, mindfulness, and breathing techniques to exchange patient outcomes. Also, some herbals to quiet smoking for a pregnant wife's husband, and to preventing preterm birth and low birth weight. In fact, there some way like maternal stress reduction, improved nutritional intake, and healthy fats like omega-3. Thank you very much. Now, we will proceed to our fourth speaker. Our fourth speaker is Dr. Nursikit Priyanto MKep from Indonesia. It is a pleasure to welcome you to our webinar, Dr. Dr. Nursikit Priyanto MKep will deliver a presentation entitled Complementary Therapies in Community, Gerontological and Family Nursing in Indonesia. Before I invite him to present his material, allow me to briefly read his curriculum vitae. Dr. Nursikit Priyanto MKep is a nursing academic from Indonesia who served as a lecturer in the nursing study program and as vice rector fourth at Muhammadiyah University of Magelang. His expertise focused on chronic illness and community health nursing, with extensive experience in academic work, community-based nursing, and health promotion programs. We are truly honored to have such a distinguished and inspiring speaker with us today, and we are grateful for his willingness to share his knowledge and expertise in this forum. As with the previous speakers, the allocated time for this presentation is also 35 minutes. Ladies and gentlemen, please welcome Dr. Nursikit Priyanto MKep. The floor is yours. Please proceed.
Thank you very much, Mrs. Leah Agustina. My student. Assalamualaikum warahmatullahi wabarakatuh. My dean, my vice dean, head to program professionals, head to committee, PhD, is Adi, Leah Agustina. Thank you very much from meeting. In last presentation, complementary therapies for various health disorders in Indonesia. Apakah sudah terpantau, Mbak? Ya, sebentar.
Yes, sir. Your presentation screen is clearly from our side.
Thank you. Miss Leah. I stop it. Definition in Indonesia, complementary therapy is a way treating disease is carried out as the support of conventional medical treatment or as alternative treatment outside of conventional medical treatment. According to the Minister of Health Regulation, complementary therapies is an action given as part of health nursing, consisting of various forms of health practices other than conventional action, aimed at improving health level at the primary, secondary, and tertiary prevention states, and
Yes.
obtained special education is of nursing.
Can you full the screen, please?
Okay. Are you looking for monitor, Mrs. Lia? Okay.
Yes, sir.
Goal of the complementary therapies in Indonesia, number one, improve the function and functioning of all body organs, but of the immune system against disease, stabilize all activities the body natural healing mechanism. Basic in complementary practice in community in Indonesia for three area. Number one, quality personal. Number two, healing process and caring. Looking the nurses, doctor, and other therapists. Basic in complementary practice. Number one, serve as health, present, and therapeutic listening. Number one, serve as health. Self-afferent and self-care are important part of holistic nursing practice. Individual exploration regarding knowledge, self-awareness, and spiritual development in as a continuous communication between the inner and outer aspect of a person. Nurses must be balanced and fully present for patient on their healing journey. Number two, present. It is a complementary therapy that is integrated into all complementary therapies. Look, it can be used alone. Number two is to present oneself physically and psychologically to the patient of the purpose of meeting to provide to care the patient need. And number three, present is very much in line with caring. Types of present. Number one, partial present, full present, and transcendent present. Key component interaction by person, intersubjectivity, direction of the self towards another, attention and accountability. Necessary skill, centering, sensitivity, and openness, communication, and activity listening. Therapeutic listening, an integral part of the client's relationship. Number two, listening is an effective and dynamic process in interaction that requires attention to the client verbal and non-verbal cues. Variation that can be used in listening include active, therapeutic, empathic, and holistic. This diagram, environment theory of foreign rectangle. Number one, ventilation, environmental comfort and cleanliness, and adequate nutrition. The main action in the holistic nursing therapy process. Number one, management body mind, management exercise, and management nutrition. Classification of complementary therapies in Indonesia. There are 6. Number one, mind body therapies. Number two, alternative system of care. Number three, lifestyle and disease prevention. Biological based therapies, manipulative and body based system, and energy therapies. Based the commentary in Indonesia, medic commentary, medic acupuncture, barbaric terapi, herbal medic terapi, based on Permenkes number 1105/27 and the update nursing commentary Permenkes number 15/28. Type of commentary nursing action, touch therapy, for example, visit acupressure, reflexology. Therapy for example, relaksasi progresif, guided imagery, hypnotherapy, aromatherapy, and herbal therapy. Nurses' role as a patient need for commentary therapies, provide advice to therapists, patient and family regarding the type of the therapy they consider, provide health education to patient and families about the benefit and drawback, risks, side effect, expected result, duration of therapy, and interaction with conventional treatment, how to access information. Monitor and discuss within the team any problem arising from therapy, facilitate patient on families to meet with the therapy team and understand their background, qualification, and competition. Provide advice to patients to visit therapy facilities to find out the quality of service and cost. Encourage other therapies if one therapy has not shown result. Integrated healthcare, commentary alternative the terminology used in academic medicine. Number 1, commentary medicine. Number 2, alternative medicine, and number 3, integrated health. Major model is number 1, mind body, natural product, and body based. The evidence-based approach, integration in top-tier in university health system requires scientific validation. Core pillars of integrated research. Number 1, botanical medicine. Pharmacogenicity research focus on standardization active compound. They recommend for inflammation and assessing for drug interaction via pathways. Number 2, mind body intervention, and number 3, manual therapies. Prevention of use adult, yoga, meditation, chiropractic care, massage therapy. Ya. Tentunya ini jadi pertimbangan. Academic integration, academic consortium, AVL 75 highly estimate academic medical center and affiliate institution are member of the academic consortium for the accredited medicine of health. Clinical guideline of patient safety, pharmacokinetic interaction, quality and standardization, open communication, risk benefit assessment. Definition clinical phytotherapy. Clinical phytotherapy represents two paradigm from traditional herbalism to evidence-based medical practice. Number 1, complex matrices, evidence metric, and medical application. Mechanism of action, pharmacodynamic, synergism encourage effect, phylomarcology, and microbiome interaction. Herbal therapy in Indonesia, definition, is the use of plant of fat, leaf, root, seed, or the extract for the purpose of the preventing or curing disease and other. Classification of natural drug BPOM Republik Indonesia. Number 1, definition of jamu. Traditional medicine whose claim of efficacy has empirically proven based on the expression generation of the community and has not undergone clinical medicine trial, standardization, herbal medicine, and phytopharmaca. Efficacy of medical plant. For example, in Indonesia dikenal kunyit ya, kurkuma, number one ada jahe, singrober, and sambiloto. Sambiloto itu di daerah khusus ada di Indonesia. Medical precaution drug interaction, number one, the myth of the absolute safety, risk of fatal interaction, consumption, transparency, and preoperative discontinuation. Demikian Mbak Ria, file my presentation Komplementari Indonesia pada saat praktek profesi. Kita sampaikan ini peserta juga karena banyak dari program profesi ya Mbak Lia. Implementation for the complementary therapy in Indonesia bisa meningkatkan maupun pertimbangkan kearifan lokal. Mulai dari ada jahe tadi, ada timun, ada hasil-hasil penelitian yang lain yang tentunya nanti akan diimplementasi. Demikian Mbak Ria, nanti bisa dilanjut ke sesi diskusi. Ini saya monitor, serta juga banyak dari mahasiswa profesi. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much to Dr. Nursike Priyanto MKep for such an insightful, inspiring, and comprehensive presentation. We can conclude that complementary therapies in community, gerontological, and family nursing can support holistic care by helping individuals and families manage symptoms, reduce stress, and improve their quality of life alongside conventional treatment. Ladies and gentlemen, we now come to the second question and answer session for the presentation delivered by Dr. Bosaken Seharatanapattum PhD RN FNP and Dr. Nursike Priyanto MKep. For this session, we have prepared 5 minutes for question and answers. Participants who would like to ask questions may kindly type them in the chat box alongside with their name, institution, and the speaker to whom the question is directed. If you would like to ask directly, please use the raise hand feature. We will now begin the second question and answer session. Thank you. Let us proceed with the first question here in the chat box. Good morning and Sawadika. My name is Indah. I'm Indonesian and currently study in Chiang Mai University. Thank you for your insightful presentation. I have 2 questions. What are the main challenges in training healthcare personnel or community health workers to deliver standardized complementary therapies? Given that 60% of NCD patients already utilize their therapies, what are the biggest challenges in ensuring patients safely combine them with conventional medicine without adverse drug, herb, and interaction? Thank you for Jayanti Indah Laila. The question is addressed to Dr. Bosaken. Please proceed, Doctor.
Okay. Thank you so much for excellent question, right? So, the most important is we should not recommend the patient script their medicine that's provided by the physician. However, for the alternative medicines like herbs or supplementary. It depends on the health status. However, to be safe for the patient, the family nurse practitioner or the registered nurse should recommend them to consult with their therapist or the physician first before they take the herb or medicine to prevent the drug interaction. Otherwise, you know what? Otherwise, they will have the problem with the lesional drug use. Yeah. Thank you.
Thank you very much, Doctor, for your insightful response, and thank you for Indah for your question. And now we will move to the second question. We will wait for a moment.
Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh.
Good morning, Dr. Busakon and Dr. Sugitrianto. Thank you for your informative and interesting presentation. I really enjoyed learning for your study. But I have one question for Mr. Sigit.
Yes,
My
Mbak.
question is, considering Indonesian diverse culture and healthcare setting, what are the greatest challenges nurses face in implementing complementary therapies, and what strategies can improve their accessibility, safety, and effectiveness for patients? Mengingat Indonesia ini memiliki keberagaman budaya dan kondisi layanan kesehatan yang berbeda-beda, apa saja tantangan terbesar yang dihadapi perawat dalam menerapkan terapi komplementer, dan strategi apa yang dapat dilakukan untuk meningkatkan aksesibilitas, keamanan, serta efektivitas terapi tersebut bagi pasien? Terima kasih.
Thank you very much, Mbak Siti Khofifah. Melalui Mbak Lia ya. Oke.
Yes.
Menghindari salah paham, karena tadi juga sudah ditransit. Tentunya di Indonesia dengan beragam ya budaya, ini sangat penting Mbak Siti Khofifah. Sebagaimana contoh di daerah tertentu, tentunya yang kita kembangkan jangan sampai bertentangan dengan budaya yang memang terapkan, dipercaya di daerah tersebut. Ini transkultural of nursing. Kalau berbenturan dengan budaya, tentunya akan sangat sulit. Baru mau memberikan suatu awareness saja, sudah terjadi penolakan. Jadi tentunya kita harus melibatkan tokoh di daerah tersebut, sebagaimana tokoh agama atau tokoh lain yang disegani, sehingga apa yang disampaikan itu akan dikuatkan oleh tokoh agama, sehingga akhirnya nanti akan terbangun awareness. Setelah terbangun awareness, akan bersedia menerapkan. Contoh di daerah tertentu, ya kita nggak nyebut ya, mengkonsumsi sayuran yang tidak dimasak. Nah, ini kalau tidak terjaga kebersihannya akan menimbulkan masalah. Prinsipnya perlu kita mengetahui dengan kearifan lokal, Mbak Siti Khofifah. Demikian Mbak Lia Agustina, supaya tidak no sinyal, ini kita jawab prinsip bahwa pengembangan terapi komplementer ini hanya terapi tambahan, tidak boleh sebagai pengganti terapi utama yang harus dilakukan lebih dahulu. Demikian Mbak Lia, Mbak Siti, terima kasih.
Thank you very much for Dr. Sigit for the insightful response, and thank you for Mbak Siti Khofifah and Indah for the questions. Ladies and gentlemen, due to the limited time available, we will conclude the second question and answer session here. Thank you to all speakers for the enlightening response, and to all participants for the engaging discussion. move to the next agenda. As a token of our sincere appreciation, we will now proceed with the certificate presentation ceremony for our distinguished speakers. May we kindly invite the Dean of Faculty of Health Science, Muhammadiyah University of Magelang, Ma'am Nurse Kartika Wijayanti, to present the certificate for our distinguished speaker.
Oke, Mbak Ria.
Yes, ma'am. We kindly invite the Dean of Faculty of Health Science, Muhammadiyah University of Magelang, Ma'am Nurse Kartika Wijayanti, to present the certificate for our distinguished speakers.
Yes, thank you, Mbak Ria and friend. On behalf of the Faculty of Health Science, Universitas Muhammadiyah Magelang, I would like to extend your sincere appreciation for your time, your wisdom, and your commitment to advance health education. As a small token of our gratitude and respect, I would now like to present you with this certificate of appreciation. May now I invite Dr. Botsakon, SQt PhD RNF NP from King Mongkut Institute of Technology, Lat Krabang, Thailand, to kindly come forward to receive the certificate. Thank you, Dr. Botsakon.
Thank you so much for your kindness, and I hope that we will have the opportunity to continue our international later. Thank you.
You are welcome. And now I now invite Dr. Nasikit Prianto, Magister Keperawatan from our own Universitas Muhammadiyah Magelang, to kindly come forward to receive the certificate. Please. Thank you, Mr.
Thank
Sigit
you very much,
Prianto.
my dean, your committee. Thank you, thank you.
Okay. You are welcome.
Thank you very much for Dr. Nurse Sigit Prianto MK, Dr. Busekan, and Ma'am Nurse Kartika Wijayanti. It has been a great honor for me to moderate this seminar session today. On behalf of the moderator, I would like to express my sincere appreciation to all speakers for their inspiring and valuable presentation, to the organizing committee for their dedication and hard work, and to all participants for your enthusiasm and active participation throughout this event. We hope that today's webinar has broadened our perspective, strengthened academic collaboration, and provided meaningful insight into the role of complementary therapies in nursing practice across different countries and settings. With that, I conclude that the seminar session. Wassalamualaikum warahmatullahi wabarakatuh. Thank you and have a pleasant day. I would now like to hand the session back to Shiva as the master of ceremony for the next agenda. Thank you.
Selamat Bu Dekan, Pak Kaprodi semuanya, komite, izin lip nggih.
Thank you to our moderator for leading today's scientific session so professionally. Our sincere appreciation Also, thanks to all distinguished speakers for sharing their valuable knowledge, experience, and insight with us. Before we conclude today's program, we would like to invite all distinguished speakers, university leaders, committee members, and participants to join our group photo session. Participants joining by Zoom online are kindly requested to turn on their cameras. For the participant joining via Zoom, can you please turn your camera? Turn on your camera. Aku suruh senyum ya. Okay, to all of our participants, please give us your brightest smile as we capture this memorable moment together. Okay, smile all. Okay, 1, 2, 3. And then the next slide. 1, 2, 3. Okay, we have 6 slides, yes. And the third slide. 1, 2, 3. And for the fourth slide. 1, 2, 3. And then for the fifth slide. 1, 2, 3. And the last slide. 1, 2, 3. Okay, thank you so much for all of our participants. Distinguished speaker, honorable university leader, respected guests, college and dear participants, as we come to the conclusion of today's national webinar, allow me to express our heartfelt appreciation to everyone who has contributed to the success of this event. We extend our sincere gratitude to our distinguished speakers for generously sharing their expertise, to the university leaders for their continued support, to our collaborators from the Suryo Hospital Training Institution, and to every participant for your enthusiasm and active participation. We sincerely hope that this webinar has brought our perspective and strengthened our commitment to advancing evidence-based complementary therapies in community, gerontological, and family nursing. On behalf of the organizing committee, thank you once again for joining with us today. My name is Shifa Husna, and it has been my pleasure to serve you as your master of ceremony. Thank you for your kind attention. May you have a wonderful day, stay healthy, and we look forward to welcoming you again at our future scientific event. Wassalamualaikum warahmatullahi wabarakatuh.